And thank you to ANROWS for inviting me to this conference. I would also like to thank the Minister for her opening words. It's very inspiring to hear what's going on in South Australia and in Australia more generally. I would like to bring greetings from Turtle Island, where I currently sit on the traditional territory of 4 First Nations, the Anishinaabe, the Haudenosaunee, the Lunapawek, and Attawandaron peoples, on lands connected with the London Township and Sombre Treaties of 1796 and the Dish with One Spoon Covenant Wampum. And I would like to pay my respects to elders past, present, and future, and commit to conducting my work in a way that advances reconciliation and allyship with Indigenous peoples and their goals. So I will now share my screen and hope that the technology works. All right. So this is the title of my presentation, which is Mobilizing Knowledge for Wicked Problems. And it is based on work that I've done for over 20 years now in the area of gender-based violence and more specifically, violence against women and their children. So I want to frame this issue of knowledge mobilization and maybe talk about the different ways that it's referred to, but sort of unpack it a little bit and really, answer the questions, what's all the fuss and why should you care? And bring those lessons from these 4 logos that you see at the bottom of the screen, which are different partnered research networks that I've been involved with, most of which as co-lead or lead of these networks that usually include policy folks, practitioners, as well as those with lived and living experience. And maybe when I share those lessons learned, I might propose some strategies to help move knowledge into action. So the term knowledge mobilization is interesting. I prefer this term, but I certainly know that there are many other terms that have been applied to it. We'll touch on a couple of those a bit later, but this also encompasses knowledge translation and exchange, concepts like diffusion, dissemination, implementation, and so on. The reason I like the term mobilization is, at least in my mind, it gives me the visual of knowledge moving between people, between organizations, and moving in multiple directions. So we're really thinking about not only translating or pushing knowledge from producers to users, but really the movement of ideas so that we can change hearts and minds, especially in this particular problem space. So why should we care? Well, I think we live in a world of evidence-based everything. No matter where we look, we hear terms like evidence-based policy, evidence-based practice, evidence-informed is a new term that has emerged, as well as things like best practices and best practice guidelines and so on. So these are a few examples that I've pulled from some Canadian websites. The first at the top left there is one of our professional associations, the Canadian Nurses Association, and really talking about evidence-based practice and evidence-informed decision-making. Bottom left is from one of our federal government web portals. This is the Canadian Best Practices portal, and you'll see I've circled something called systematic reviews of the research. So that obviously front and center is an important concept in terms of how you would come to making best practice decisions, in this case in mental health promotion. And on the right hand of the screen is actually from one of our national newspapers, the Globe and Mail, and really is focused in on, if you're providing better mental health care, we need the evidence. And if we have the evidence, why aren't we providing healthcare in an evidence-based way? And these are some of the core questions to this problematic of mobilizing research, knowledge, and evidence into policy and practice. I quickly searched for an Australian example. It took me about 2 seconds on Google. This is from your Australian Research Council. And again, emphasizing the need to engage and have impact when we do the research. So translation to engagement and impact. So this is sort of the framing of the evidence-based everything world in which we seem to live. And I would like to sort of unpack what all of that means based on my experiences doing this work in the area of gender-based violence. So this is usually the model. When we talk to people, if you haven't really thought about it critically, you might think, well, that doesn't sound so hard. You've got a producer, let's say a researcher, or it could be an organization, a government, somebody is producing knowledge. And then at the other end, there's a user, somebody needs knowledge. And in between, there's some magical process where this knowledge is packaged neatly into the right size container, and the user can just sort of pick the box off of the conveyor belt. And it all seems extremely tidy and simple when we think of it that way. And I think what I'd like to do is argue that maybe it's not quite this simple. And I think many of you that have sort of been on the messy end of things in terms of policy and practice would agree that it's not generally this simple. But this is sort of the framing of what we think when we say mobilizing knowledge into practice, into action. And this is a nice slide that I found from two researchers that do poverty research. They call this the fantasy model of direct impact, and I've got the citation at the bottom of the screen here. Please feel free to take screen captures or contact me. My email is at the end if you'd like any of these slides. But basically, this fantasy model of direct impact is, you've produced your study, you've published it in a journal. The policymaker will read the study, then change everything and end poverty. I'm sure the minister is nodding right now saying, yes, absolutely, that's how policy works. We just need that one study that people have produced and we can change everything and then we'll have the desired outcome lickety-split. So obviously, this is called the fantasy model because this is rarely, if ever, the way that this sort of thing would work. Although I do have some examples, and if I have time, I can certainly share those stories of having policy impact when you have the right evidence at the right time with the right partners and sort of taking those opportunities. But this is a pretty rare phenomenon. In fact, when we start to look at even what we mean in terms of producing research evidence and producing knowledge that could be actionable, we start to understand even on the production side, we've got a bit more complexity. So, and as we all know, good research, which is of course what we want, takes time, takes a lot of effort, takes skill and expertise. And it really starts at the bottom of this pyramid where you're, having new ideas, thinking about things in new ways, and then developing new strategies for actually collecting and analyzing and interpreting data. So these methodological innovations need to go alongside those theoretical innovations. And then you move to the stage of actually conducting those studies. And you usually need more than one study to develop an evidence base that is persuasive in terms of action into policy and practice. Once you do the studies, you write the articles and reports. The gold standard, certainly in academia, is peer-reviewed evidence. So those articles go through what's often a fairly lengthy process in terms of, becoming published. And on a good day, they're actually accessible to policymakers because they're open access and freely available. But many of those actually hide behind firewalls, which is sort of another pragmatic barrier in terms of, accessing and using evidence, as well as often being written in impenetrable, academic jargon from a particular field, which might make it more difficult to actually understand what's being said. And of course, as researchers, we always end with, this is provisional and more research is needed, because that sort of keeps us in a job, I guess. Once we've got these individual studies, we start looking at how to synthesize research knowledge. And again, it's a bit of an art as well as a science in terms of understanding how much is enough evidence, and do we have enough evidence across different contexts, or are we just really talking about the applicability and efficacy of evidence in one particular context? And I think, one of the points I will argue is that working in a fairly complex, and I would say even wicked problem space like gender-based violence, we don't know what the thresholds are, and we're negotiating those at all times, quite frankly, especially depending on where and how research is conducted. Once you've done the synthesis, then it comes to the actionable messages. And again, the boxes on the conveyor belt, that might be one sort of message, but you might need different packages. You might need different media for translating or sharing those messages and so on. And thinking broadly, we have different audiences and decision spaces into which these messages can go, from practice and program decisions to policy and planning decisions and personal decisions. So you start to get a sense that it's a bit more complex than our little conveyor belt. And all of this is based on the notion that evidence has an equivalent role with other key drivers of decision-making or policy development or practice protocols, so that evidence is one of three equivalent sources of information along with context and values. And when we start to unpack context and values, we also see how complicated this can be. Context can mean anything from an individual person's health condition or violent situation where they have to see, is this the right time to leave an abusive relationship? Do I even want to leave this relationship, or do I just want the violence to end? Values can be things like, do we live in a society that's actually ready to shift away from violence, aggression, and patriarchal norms, such that we would actually use resources to prevent gender-based violence. And into those complexities, which happen across the ecological framework from individual to societal, you're trying to insert evidence, which is always provisional and always imperfect, I would argue. That's why we keep doing research, to better improve our knowledge base. So the assumption, doesn't usually hold clear. Oops. Okay. But as I said, there are different challenges, both on the producer side and the user side. And, you can think of many different potential challenges, but certainly one that comes to mind as a researcher myself is that our research timelines, the research cycle, including the things that we're incentivized in the academy to do, quite frankly, are not always a good fit with the user side needs. Okay, so it takes a long time to do good research and to have those multiple studies, but often in a policy context, for example, a policy decision maker will need things right away. In terms of user side challenges, again, your timelines, information overload, you're bombarded with information from different sources, whether there are resources available, you have access, for example, to open access versus firewalled materials, and just the skills and time to be able to assess and understand and apply the research that might be available. So all of these things complicate this space. And I would say one thing that we are acutely missing, except at ANROWS, which does a brilliant job of this, is these well-articulated intermediary roles. And these can be knowledge brokers or other titles, but people whose job it is, who have the training and the skills and the resources to actually bring those two worlds together, to look at the evidence and say, how best can I formulate this for this type of user? How can I shape that box, and which conveyor belt should I use to make sure that it is most likely to be taken up? So, and I guess the last point I would make is we always in our minds have this notion of use of research and use of knowledge as very instrumental, that whatever we're producing, people will take it and they will make a decision with it, or they will change their practice or change their behavior based on that evidence. But in many cases, the use is actually not immediately instrumental. And I think this links back to why I like the notion of knowledge mobilization, because in the first instance, you need the idea. And the idea needs to sort of have a hook and find a home in a new space, whether it's somebody's mind or a discussion or a policy process. And so the use might be more conceptual or symbolic. So it might change the way you think or be used to help support another argument. And I would say that regardless of what type of use is being made of the information, it's not always predictable, nor is it always intended. So as we create messages, as we try to shape knowledge in ways that would be useful for different audiences, we do have to keep that in mind, that people will use it as they will. And at some point, as the producer of knowledge, you sort of lose control of that process. You can do your best to shape it the right way, but essentially people will take it up and do with it what they will. And I'll show you a paper where we did a bit of an analysis of this later on. Okay. So, as I said before, we've got these three circles, but the reality in many practice and policy contexts is that the evidence circle is very small. And in this case, I have it sort of in a dotted line, and often it doesn't exist at all, quite frankly. So if those timing issues are a mismatch, so a policymaker needs evidence right away and it's not available, they will go ahead and make the decision without the evidence. And I've got a little stat here. This is a fairly well-known one at this point, but even medical research, which I would say much of which is a lot less complicated than the sort of space that we work in with this complex psychosocial topic that is gender-based violence, even relatively simple evidence from clinical research takes approximately 17 years to find its way from the research base into actual changes in clinical practice. So we can start to get a sense of, that fantasy model really is that. It is a fantasy model. It is very difficult without a lot of preparation and resourcing to do this work effectively. And we do have a lot of models that have been developed, and this is a fairly new field. So I do think we also have to recognize that the work has started maybe 2 decades ago, 2.5 decades ago, and it really has accelerated. And there are a bunch of lovely models that have looked at this from different perspectives. So we've got sort of producer push models, and when you hear terms like diffusion of innovations or dissemination, that's normally what we're talking about, that the producer makes an effort to push the knowledge into the world. And it may or may not be tailored, and it may not be particularly effective, but at least there's an effort to sort of push that knowledge into the world. On the flip side is user pull sorts of models, and these are often called things like utilization, research utilization, or implementation science. I would add continuing education as part of our user pull model, but basically the user has a need and goes looking for evidence. And then this third category of exchange or integrated knowledge translation or knowledge translation and exchange really is about this partnered approach where you build and nurture relationships. You teach each other, both from the producer and user side, what the capacities are and how to use research, but also how to think about things for a policy context, for example. And researchers probably don't have a lot of experience in that. In this case, you co-develop and identify those priorities. And the co-production of knowledge is a pathway to uptake. So I would say, because the decision makers have helped identify those priorities, it increases the relevance of the answers and the buy-in to actually using the answers. And this is what helps lead to uptake. So this is just one model. I'm not going to go through it. It's from Ian Graham and colleagues. It's called Lost in Knowledge Translation. And just to say, I just show this to make the point of how much more complex this is than our original conveyor belt graphic that I showed earlier. And it's more work for everyone. So when you actually commit to an integrated knowledge translation process, including the things sort of at the top right of this model, where you're monitoring and evaluating and trying to embed and sustain knowledge use, it adds work for everyone, both the researchers and the knowledge users. And if we don't account for this and resource it properly and create the infrastructure underneath it, then it won't happen. And I think that's a really important point. So I'll switch quickly to lessons learned and try to sort of roll this up in my last 10 or so minutes. First is this little diagram I put together because I always want to differentiate between the traditional academic model and what it means to start doing things in this knowledge to action or integrated KT sort of way. So the usual academic model basically includes these things: academic dissemination, which includes papers and conferences. Okay, so that's, and frankly, that's what we're incentivized to do in the academy. When you hear publish or perish, that's what this means. And these are the things that go on your CD, and these are the things that are assessed in your annual performance appraisals and in your promotion and tenure processes. So there's a drive to do this work, to get your grant and then to basically publish, and then get your next grant and publish, et cetera, et cetera. And I would say this is extraordinarily important work because, as I mentioned before, the gold standard for having evidence is peer-reviewed publications. So this is the evidence base. So researchers sort of have to keep doing this, not only because they get promoted, but because without it, we don't have a viable evidence base. And researchers who have a commitment might do a little bit of what we call in Canada end of grant KT or knowledge mobilization. So maybe a few summaries of research, maybe a press release, non-academic talks, that sort of thing. But that happens after the research is completed, where you basically say, I think I could make this a little bit more usable by coming up with a one-pager of my completed research. When we're getting into this integrated mode of things, where you're involving research or knowledge users from the beginning of a project, it adds a lot more work. So in this case, you have to know about and then discuss and negotiate what the priorities are, whether they're practice priorities, policy priorities, or both, because both might be important in some contexts. And that takes a lot of talking and listening, quite frankly. So intentional and strategic discussions around what the best research is in that moment, if there's funding available for it, who's going to do it, et cetera. And then once you've done the research, is thinking about the sorts of products that are a little bit more evolved than our boxes on the conveyor belt. So tailored products that are targeted to particular audiences, both in the product, but also in how it's delivered. And we now have many more options for that, from those animated video whiteboards, which I really like, to podcasts and many other multimedia ways to share knowledge. But we also might need these, what I call middle documents, so backgrounders or policy briefs, reports that actually report enough of the evidence that people see the heft there without it being the jargony academic paper. And then I found that certainly policy folks really like those quick hits, those infographics and things that really distill the key findings up at a very high level. So they've got that data hit right in front of them. As I said, I'd like to add continuing professional education as another form of knowledge mobilization, and looking for ways to embed new evidence into learning and practice resources, whether it's e-learning or classroom-based learning. So as you can see, this is adding a lot more effort and work than just the academic dissemination and academic papers piece. And I think we need to really consider who's doing this work and who's paying for it. So my first overall lesson, and I only have 4, is that evidence really is only one kind of knowledge. And we have to not only recognize that, but respect that knowledge and evidence are coming from different actors in this system. So this is a diagram. It's got our 3 circles here. It comes from a policy relevant piece by Jacobs et al. And it also adds the broader environment and organizational context, as well as different levels of values and expertise and resources. It's a little limiting because it just talks about decision-making and not sort of the symbolic and conceptual uses of evidence that I spoke of before, but you sort of start to get the feeling that there's more going on here than our simple circles and our simple conveyor belt. And then, this is a graphic that we did for a book that I edited a number of years ago called Mediating Health Information. And, many of you might actually relate to this poor person in the center of this little graphic here, feeling overwhelmed. There's information, data, requirements, needs, coming at you from all angles. And you may not have the time, resources, wherewithal to actually deal with all of it, but you have to. And that fire hose hasn't been getting better in the last couple of decades. We just have more sources of information and more ways for it to get to us more quickly. And I guess another point I would like to make here is sometimes all of this evidence actually produces a lot of cognitive dissonance. And we see this in practitioners, for example, when we do workshops around emerging evidence, that, the new evidence might actually contradict the way that people have been doing things for years. And that might make them feel a little disrupted and uncomfortable. And I think as those who are trying to persuade people to change behavior, we need to be respectful of that and sensitive to that and find ways to bring people along rather than just saying, no, you're now doing it this way. And if you don't, wag your finger and blame. That is not actually a very good way to get people to come along, especially in a topic like gender-based violence. And I mentioned before this notion of malleability of evidence, and this is this paper that we did in 2013, where we looked at how people took up, just in other journal literature, our findings on universal screening for IPV not being particularly effective. And people just did with it what they wanted to, quite frankly. Some people didn't like the one finding, so they would just say, well, this paper is not good, so we're not listening to this, but we like this other finding in the same paper, so we're going to take that one. And it was actually quite fascinating to see that people will do with it what they will, and instead of just getting frustrated about that, just sort of realizing that we have to do a better job of communicating clearly. The second lesson really is about this notion of partnership and what I call the 3 T's, although 3 T's just sounded better, but talk is really as much about listening as it is about talking. And, this is about developing trusting relationships, and it does require some face-to-face dialogue, then supported by technology. And really, it's based on mutual respect and, recognition and negotiation of different priorities and timelines. That all has to be done up front. And follow through. People will trust you if you do what you say. If you don't, then you don't have a basis for a trusting mutual relationship. And I would definitely argue for having a discussion up front about values. So it's not just about what problem and how we're going to tackle it, but why are we doing this together? What are the underpinning values of this work? Because I think that makes it much easier to know what you're going to do when the results ultimately come. And all of this, of course, takes time and effort and requires resources that are built in from the front. So that leads to my third lesson, which is that, none of this is tidy. These are essentially human processes that are iterative, nonlinear, messy. Sure, absolutely, you can plan and have work plans, but you have to be flexible and willing to compromise during the process. And, being opportunistic is really important, finding those moments of when a policy window opens, in Canada for many years, almost a decade, nobody was interested in violence against women research. And then all of a sudden we had a new health minister who it was near and dear to her heart. And she put a lot of money and attention to the issue, and boom, the window opened, there was funding, and we had to get together, build on the existing partnerships we had and find ways to do good work in this space. But there was no warning that this was going to happen. So you do also have to be ready. Context is extremely important. You really need to understand where the evidence is going and what the intended and maybe some anticipated unintended uses might be, and what the consequences of that are. And I would say that all of this applies in any partnered research, but in the work that we do in gender-based violence and domestic violence and violence against women, it is additionally complex. And these are wicked problems that makes the messiness even worse. And therefore, more time and effort are required. And we really need to think up front about what success looks like and what we will do with successful outcomes. And, importantly, what we might do if we don't get the outcomes that we want to see. So I think we need paradigm shifts when we're talking about moving knowledge and evidence into action. So fundamentally, when we take this approach, it changes both the way we do research and the way that we conduct our policy development and our practice. So you can't predetermine everything and then attend to shifting sands. One thing I've certainly found is the timeline of research usually means that by the end of your project, the partners you started with don't work there anymore. Like the same people are not in those organizations, they've moved on. So how do you accommodate for that? And how do you never lose a partner? What I like to do is follow those folks wherever they go and make sure they're still a partner. And I think this notion of disruption is extremely important, because you can't really innovate without being disruptive, but this disrupts our usual ways of doing things. And I think we just have to be aware of that. And again, this potential for an uneven fit between all of this evidence and the imperative to do things in an evidence-based way, but also academic culture and the way our funding bodies actually fund research, and also the way bureaucratic processes might work in terms of practice and policy change. And one question I always ask is, if we're doing all this based on existing problems, we need to leave space for curiosity-driven research. People still need to do things that are outside the box and have that ability to discover new ways of thinking about things and doing things. So I always leave a space for that. So in terms of strategies to move knowledge into action, time, skill, resources, from an academic perspective, not everybody is good at this sort of thing. I know many academics whom you wouldn't want speaking, in public, trying to explain the research, because it would be very jargon laden. So this to me is a call again for those intermediaries or brokers. Systems need to actually recognize the effort and time that goes into this and provide incentives, and also provide funding or other sorts of resources to do the work. And again, for our problem space, I think it's very important to develop consistent and persuasive messages, because as soon as there's any nuance, people jump on it and tear it apart. There are always people looking for excuses not to believe what we have to say as advocates and researchers in the area of gender-based violence. And to do that authentically, we need to include people with lived and living experience. We need to examine the harmful systems and structures. That includes policies and protocols that might block the development and application of good research, and coordinate our policies and services in a trauma and violence informed and culturally safe way. And again, when adapting from one, evidence is usually collected in high resource settings and with lots of research assistance and everything else. When we adapt into context, we need to ensure that those things are authentic and sustainable. And I mentioned the idea of disruption and the importance of values. So just to end off, key messages, which are the foundation of how we communicate and sort of mobilize these new ideas. Here's some advice in terms of creating key messages from the Canadian Foundation for Healthcare Improvement. So first of all, they have to be appropriate and, intentional for the audience. So the tone, the content, the language has to work for the people with whom you're communicating. And it really goes beyond a summary. You want to explain what the research results mean, why they're important, and importantly, what action you feel should be taken. So you're verging then into recommendations based on your research. And there's always a fine line. You can't overpromise with these things, but you certainly want to at least lead people towards action. And I would say that you want to frame this in the form of ideas rather than data, because it's ideas that will enlighten people on issues and give them that inspiration to handle it. So in sum, key messages tell the story of the research and its potential impact and are contextualized for the audience. So I will stop there. I think I'm a couple of minutes over time, but not too bad. This is my contact information, and I would urge you to be in touch or to visit my website or the Gendered Trauma and Violence Knowledge Incubator for additional resources. Thank you so much for your attention today.